Productive Dentist Academy podcast network.
Welcome to the Everyday Practices Dental Podcast. I'm Regan Robertson, and my co-host, Dr. Chad Johnson, Dr. Maggie Augustin, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take into your own dental practice. If you are ready to reclaim your time so you can focus on great patient care without sacrificing yourself along the way, buckle up and listen in.
The key takeaway is storytelling is critical because while there is artificial intelligence, the impact of that artificiality is real impact. So we need to make sure that we have real people telling the story to connect all of it. It is critical, and it's not going to go away. It's not going to go away. It can't.
Welcome to another episode of Everyday Practices Dental Podcast. I am your host, Regan Robertson, coming to you live, sans Chad, sans Maggie, because I am at the possible event in Miami. This is where the world's largest, and I do mean the world's largest, chief marketing officers and innovators gather. There are 5,200 people here. It's like South by Southwest for marketing nerds. And one of the great things about attending events like this is, just like you, doctor, the ability to network and meet like-minded peers that they get you excited, they get you jazzed up again, and they inspire you. And I'm bringing on a guest live from Miami, Aleisia Gibson Wright. She is a woman and entrepreneur that I met during a table talk, and we both connected immediately discussing media and patient communication and being authentic and what it means in today's world as it's rapidly changing with AI and everything else going on. Aleisia, welcome to our podcast.
Oh my gosh, Regan, first of all, it was so much fun sitting next to you or sitting across from you on that table talk. You know, I think the discussion here has just been so fruitful in terms of all the things, the possibilities for AI and what that means even for patient care. I mean, a lot of this conversation is about consumers, but we got to remember patients are consumers, and the way we're operating now, patients are functioning as, they expect more, and because they're paying more and they expect more, and the consumer patient convergence has happened, and AI, I think, will be the reason why it will continue.
I agree wholeheartedly. And some of these speakers that we've heard, I heard the CMO of Visa get up with the Institute for Futures, Dylan somebody, and they were talking about how virtual assistants and AI will just become part of our lives together. Take our listeners back a little bit, and your organization is GW Health Public Relations. Introduce yourself and give everybody a little bit of a history about yourself and then why you're so passionate about communications and PR in general.
Yeah, absolutely. So I have been in PR for 25 years. I've worked at most of the big agencies in PR and advertising, but always in a PR capacity. And I've always worked in healthcare. That's been my passion. It will always be my passion. I will never peddle shoes. I never will. So what fueled me to step out on my own about 7 months ago was the fact that even being at the helm of some of these large products, of pharmaceutical products being launched, it just was just me as a Black woman around the table for the most part. And when you have like a limited amount of influence, or not a depth or breadth of influence for all people, that's a problem. It's a problem, especially in something as personal and specific as healthcare, in how we all engage in healthcare, how we communicate about healthcare, what our history is when it comes to healthcare. So I stepped out on my own to try to do it better. And that really is to connect culture and health, what that means, being specific to how people will receive information. So that's why I'm here, and that's my purpose.
You were at the perfect time in history, I think, for this to happen. And something that I say often is people want to be seen, they want to be heard, and they want to be understood more than anything else. And it shocks me how many times we overlook like as a collective, and you think of large organizations in particular, overlook certain segments. And if Dr. Maggie were here right now, she'd be falling over with excitement because she's particularly excited also about making sure that people are seen and people are heard. And what you and I were connecting on yesterday was consumers have money, even if they are in a demographic that wouldn't be wildly
Right.
recognized typically, and they still have needs. And now we are in this not one to many way of marketing out to people, but many to many and personalizing that message for them. So talk to me about your endeavors and specifically how you're interested in personalizing that experience so that people that you want to serve are educated about oral systemic care,
Right.
are educated about what's available to them, and they can onboard it and hear it in their language and be ready to, take that next step.
So I'll start with you had me at oral care because oral care is, I think, something that's been so overlooked in certain populations, right? We know that Black and Hispanics tend to over-index in cavities, in periodontal disease, and the whole spectrum. And a large part of that is because of access, limitations in access. I mean, and when we talk about access, we can't forget like the rural communities that are, left with, I think there was a stat, it's like 25 dentists for every 100,000 people in certain states. That's not tenable. Of course, people are going to be left out. And what we know about oral care is a healthy mouth or an unhealthy mouth equals a healthy or unhealthy body. And all of the sort of um, diseases that are so prevalent, diabetes, heart care, or cardiology, all of those things are all interconnected with our oral care. And people don't realize this. I think there was a study maybe like a decade ago that showed that there was a correlation between oral health
Yes.
and cardiovascular health.
Absolutely, through your carotid artery. Yes. So, and genetics and all the other risk factors. Shout out Dr. Bradley Bale and Amy Doneen.
Yeah, all of those really important things. And what I know, just having worked in healthcare for so long, it's amazing that you just learn all of this stuff. What I learned was that some nationalities, Black people in particular, have more grooves in their teeth, in their molars, which predisposes them for cavities.
I didn't know that.
And
That's
listen,
crazy. Yeah.
I know it because I am a Black mother who had a 1-year-old. As soon as her first tooth came up, like we're in the dentist, like that thing is getting treated. So, so the tooth came up, the molars came up, and they had cavities.
So there are more grooves in Black people's teeth than other nationalities.
So yeah, apparently, according to my children's orthodontist or their dentist, this is common. This is how our teeth are different. And you have to think like there are structural differences between the races, and that's why you can't overlook
Yeah.
or you can't broad brush, treatments
Yeah.
just because the person is a human. There is some specificity that needs to happen, even in dentistry and oral care.
So tell me what your impression of this event has been, because I want to go into the how of how you help your clients and how you help the message get out, especially around the education, because this education piece, especially in rural areas, we know is important. But you and I are both here to stay on the cutting edge and to figure out what's coming down the pike. This totally reminds me of South by Southwest 2012 era. A lot of people are saying that AI is like the internet, only more, or like electricity, like it's that big of an invention. So what are your big like 3 takeaways so far this week?
Okay, so my big takeaways are the fact, to your point, AI is not going anywhere. You either get on board or you get left on the platform. I can't be left on the platform because working in a field like communications, you have to be relevant. You have to stay up on what is happening in your industry. And I think there are huge changes that we are just on like the precipice of. Like it's about to happen. AI, I think, will help us in the long run. But I think there are so many blind spots in AI that we've got to, as fast as it's moving, we've got to be able to correct it just as quickly. So we need AI to help AI. Because, and working in healthcare, like one of the big issues is that there's so many medical inaccuracies in medical texts. It is, you would be shocked.
How many errors? You say medical text. You mean like textbooks, text messages, text what?
At text, check all of the above. Yes. So doctors are learning erroneous things. I mean, they're bloggers now. They've sort of brought a lot of this to bear just on even how we are assessing humans and assessing people of color. It's not based on fact. It's based on a guy from the 1800s who came up with a theory, and however it is, it made it into medical text, and it's still affecting people of color. And that's why we have so many health disparities, because we're not being treated the right way, or certain scans that we have, like kidney disease, for example, are erroneous in their assessments. So, I mean, I'm not a nephrologist, but there are things, and anybody can go on the internet and just find that these people are talking about these things now. So, I think there's a lot of really great things in AI. I mean, it's going to help with triaging patients when they come into the ER. Mental health will be significantly improved, I think, potentially by some of the new technologies like artificial intelligence. I think there are a lot of really great things. We just have to make sure we are correcting as quickly as we are moving. We've got to keep these things parallel.
My big takeaway from this, which brings me so much hope and inspiration and joy, is I definitely think of AI as a tool. And I came up in the generation where I saw the hand-drawn artist go over into Photoshop, and I saw the fear and panic at that point in time. And I was just excited and motivated by it because I found it to be a way that it's how we could elevate our work instead of replace our work. And we found that artists are still prolific and beautiful and gorgeous, and hand illustration is still has a place in this world. So I think of AI in the same way. From a marketing lens, my big number one takeaway is human connectionists will always be relevant.
Yes.
The buzzword authenticity, I have heard that probably every workshop I've been at so far. So truth, authenticity, Gen Z values reality and truth predominantly, so they can see through a scripted brand any day of the week. So throw away your scripts, throw away what you're supposed to think. I believe that it's going to be a lot more difficult to be truly authentic for a lot of brands than they might think, because it does mean being vulnerable, being transparent, and being real. Bobby Brown she did the big.
Oh, I missed that section.
She was
So upset.
of all the speakers. Like I saw Martha Stewart on stage, I saw Gary Vaynerchuk on stage, and when she came up, she to me was one of the first speakers that demonstrated being authentic. She showed up in jeans. She had her very minimalist makeup. She had like a t-shirt with her little cardigan over it, and she said, when I feel comfortable, I'm more confident. Which we always say that, right? When you're comfortable, you're confident. But she explained her take on how she brought that to life, and a lot of it was squashing down fear. And so I'm taking away from this conference, storytelling will be absolutely paramount. AI can support us in it, and the brands that are intentional with AI, and you and I know how many areas AI can show up in a patient's journey, and if it shows up bad, then trust is broken. So for example, an AI bot called me from an imaging center and to go get some imaging done. They called me on the phone, and I was like, oh goodness, oh hi, I'm talking to an AI bot. And they said, we're going to schedule your appointment for you. We need to connect you with someone. They connected me to voicemail.
Oh, see.
And I was immediately put off. And so if you think about those little micro moments of trust where trust is built with a brain and broken, it was broken. And that's because we're in the Wild West era, I think, of AI. It's messy. Or if you see a little baby chick that's really cute and then a hen that's really pretty, but that middle phase, it's a very ugly chicken.
Yeah, where the feathers are kind of gray and brown. Yeah.
Yes.
We got it.
Yeah. And I know personally I put my eggs in the right basket. I mean, I really have focused on the last 5 years on developing my storytelling ability. And then for Productive Dentist Academy and all, we've always valued great storytelling. And so I think AI will just be a supplemental tool that we can use, but it's going to be applied in every way. And you guys listening, I want you to prepare yourself. It's not just storytelling to humans. It's going to be how to get our own AI agents. And if you don't know what an AI agent is, Google it or ask ChatGPT. Ask your AI agent to talk to another AI agent because that's where the world is going. So how we interact and how we sculpt those relationships is going to be major, I think, in the next 10 years.
I couldn't agree more. And to your point, the key takeaway is storytelling is critical because while there is artificial intelligence, the impact of that artificiality is real impact. So we need to make sure that we have real people telling the story to connect all of it. It is critical and it's not going to go away. It's not going to go away. It can't.
I agree. I love, everybody listening, I love to give really big actionable takeaways. So, okay, here's what I have learned that you can put into practice right now. So go look at your social media. If you are doing like kind of canned posts, for example, or a post in a blog, and it's just got like, maybe you're even using AI yourself to like generate post content and you're not seeing a lot of engagement. Gary Vaynerchuk's number one takeaway was organic content that is relevant. That wins the day over viral. So don't boost posts that are just out there for being out there's sake. Be organic in your post, be relevant, and that is what is going to get you the views. That's my number one big takeaway from today. Something you can put into practice. Did you learn anything?
I did.
Okay.
Yeah, I learned to what you're saying is don't buy your reach, earn it.
Yes.
Right?
Yes.
Learn your reach. And you can only do that when people feel that you are telling a story or engaging them in a way in which everything about them says that they should be engaged with. And you only know that by doing homework. Do your homework. Find out who your audience is. Get to know your audience. You need data before you even attempt to try something creative. And I'm with Gary. I think if you need to really prove it, put your creative, for example, on social and see what the engagement is. Don't boost it. Don't push it. Let it do it. Let it do what it do.
You can build a community that way. And I've heard this about community building at this event too, about finding that group of people that resonates with you. Mm-hmm. And it can be seductive to want to get quantity of patients. And a lot of the productive dentists that I work with, they're really discerning. They are willing to be brave and say, these are the services that I'm really good at and I'm really passionate about. Mm-hmm. And there are some doctors that are particularly passionate about airway, for example. And so when you were able to niche, there's your shout out, Chad, niche your niche into what you're most passionate about, you tend to find the people that you're supposed to find. And I think with the organic content, like you said, earn it. That really helps you figure that out. Who is your audience and what do they resonate with the most? Absolutely. Well, thank you, Aleisia, for this really great.
Oh my gosh, I'm so glad that we sat at that table and we talked, and this is so much fun.
Me too. If people want to find you and know more about GW Health Public Relations, where do they go and how do they connect with you?
You can look me up on LinkedIn or my website. My name is Aleisia, and that's spelled Aleisia, not to be confused with Alicia. Gibson, Gibson, Wright, Wright. I'm on LinkedIn, and that can connect you to gwhealthpr.com.
Thank you very much.
What a pleasure.
Thank you for listening to another episode of Everyday Practices Podcast. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.